entertainment news that you captured tonight. Moving on, as the impact of climate change continues to pose serious threat to public health, nursing professionals are being called upon to play a more active role in healthcare advocacy and policy development. This formed the focus of our public lecture for student nurses in Nigeria, organized by Nurses Across the Borders Humanitarian Initiative in collaboration with the Nigerians in Diaspora Organization Europe and the Edo State Diaspora Agency, held at the Edo State College of Nursing Sciences, Benin City. EBS correspondent Godsent Omoragbon has details.
The public lecture held at the Edo State College of Nursing Sciences, Benin City, brought together student nurses, healthcare professionals, and other stakeholders to examine the impact of climate change on public health and the involving roles of nurses in national development. In her welcome address, the provost of the college, Mrs. Mebe, urged nurses to continually build their capacity to tackle climate-related health challenges. The organizer and executive president of the Nurses Across the Borders Humanitarian Initiative, Pastor Peters Omoragbon, described climate change as a growing public health threat and called for greater involvement of nurses in policy making to strengthen Nigeria's healthcare system.
Climate change is a result of human activities, and by human activities, that means we try to change our ways of life, the things we do, and how to reduce climate emissions. So nurses need to be equipped with the knowledge on how to prevent, with the knowledge on how to develop strategies for mitigation and adaptation strategies. If nurses begin to take interest more than a passing interest in politics, they will be in a very good position to navigate, to protect and promote the interests of the patient, not just for themselves, but for the welfare of the patients there.
The student nurses, they need to know different times there's going to be climate changes, and their role, their duty, their functions, their responsibility when there's climate changes.
The continental chairman of the Nigerian Diaspora Organization Europe, Honorable Harold Ogufemi, advocated stronger collaboration among the diaspora, governments, and healthcare institutions to improve nursing education and healthcare delivery.
It is the responsibility of every single one of us to give back to the country that we're giving back to, and to make sure that the country that we represent continues to grow bigger and grow well.
Participants described the lecture as timely and enlightening, noting that it deepens their understanding of the relationship between climate change, public health, and the nursing profession.
Now that you have educated me, and I'm sure that soon have been enlightened, the first step now is to look for the manifesto of different parties, study it and see those work that I can align with, and register.
You look at how the people who make policies, they are not nurses, they do not understand what we go through in the nursing aspect. They don't understand what we go through in the world. They don't understand anything about it, but they are just there making laws, making policies that we have to follow.
The organizers say the initiative is designed to prepare future nurses for emerging public health challenges and strengthening healthcare delivery in Nigeria. In Benin, Godsent Omoragbon, EBS News.